9 test question 6. 87. A client with a known history of type 2 diabetes mellitus has a finger stick blood glucose level of 460 mg per dl. The client is noticeable lethargic and the family states that the client has had increased thirst over the last day or two. The home care nurse would anticipate that which additional finding would be present with further testing if the client is experiencing diabetic ketoacidosis. 1. Presence of ketone bodies. 2. Elevated serum bicarbonate level. 3. Rise in serum pH. 4. Hyponatremia. The correct answer is 1. Presence of ketone bodies. 88. A nurse is developing a plan of care for a client with Cushing syndrome. The client has a nursing diagnosis of excess fluid volume. The nurse understands that which of the following is necessary to include in the plan of care. 1. Monitor daily weight. 2. Monitor intake and output. 3. Maintain a low potassium and high sodium diet. 4. Monitor jugular venous pressure and extremities for edema. The correct answer is 3. Maintain a low potassium and high sodium diet. 89. A client suspected of having Cushing syndrome is scheduled for adrenal venography. A nurse has provided instruction to a client regarding the test. Which statement by the client indicate a need for further instruction? 1. I may feel a burning sensation after the dye is injected. 2. The incision site will be anesthetized localized. 3. I need to sign an informed consent. 4. I will be placed in high sitting position for the test. The correct answer is 4. I will be placed a high sitting position for the test. 90. After hypophysiotomy, a client complains of being thirsty and having urinate frequently. The initial nursing action is 2. 1. Document the complaints. 2. Increase fluid intake. 3. Assess urine specific gravity. 4. Assess for urinary glucose. The correct answer is 3. Assess urine specific gravity. 91. A nurse has developed nursing diagnosis of risk of distributed body image for a client with a diagnosis of Cushing syndrome. The nurse identifies nursing intervention related to this nursing diagnosis and includes this intervention in the plan of care. Which of the following is inappropriate nursing intervention? 1. Encourage client expression of feeling. 2. Assess the client's understanding of the disease process. 3. Encourage family members to share their feelings about the disease process. 4. Encourage the client to understand that the body changes need to be dealt with. The correct answer is 4. Encourage the client to understand that the body changes need to be dealt with. 92. A client has an endocrine system dysfunction of the pancreas. The nurse plans care knowing that the client will expect impaired secretion of which of the following substances? 1. Amylase. 2. Lipase. 3. Lipase. 4. Insulin. The correct answer is 4. Insulin. 93. A nurse is caring for a client after hypophysiotomy. The nurse notices clear nasal drainage from the client's nostril. The initial nursing action would be 2. 1. Continue to observe the drainage. 2. Test the drainage for glucose. 3. Lower the head of the bed. 4. Obtain the culture of the drainage. The correct answer is 2. Test the drainage for glucose.